Hello everyone, today I want to talk about marijuana usage in young adults, specifically adolescents and college students. This is going to be shorter, so we're going to focus on key topics such as prevalence, addiction, and physiological changes. So obviously marijuana usage has continued to rise since legalization, with the highest level being recorded in 2020. Again, this is right after legalization and during COVID-19, which might have also played a factor. And at this time, 44% of college students admitted using marijuana. This is compared to 38% in 2015. And then also in 2020, 35% of high school seniors reported marijuana usage as well. And according to Monitoring the Future study, marijuana is by far the #1 drug abused by 8th and 12th graders. Then looking at THC content, it was around 2% in the 1900s, specifically the 90s. Today, THC content can be upwards of 95%, which obviously has no proven medical benefit. And then studies have reported inflation and deflation of this content. So truthfully, we're not really sure how much THC is present in these products today. And then quickly looking at addiction as well. Adolescence is a period with increased tendencies for risk-taking, decreased regulatory control, and increased peer affiliations or peer pressure. And usage leads to this tolerance, which eventually leads to higher THC content, which we know is readily available. And this higher THC content is associated with addiction and cannabis use disorder. And then briefly looking at academics, as this is obviously very important in a high school or college student's life. There is a correlation between marijuana usage and tardiness or absences. There's also a correlation to lower grade point average and longer time to graduation. Then long-term usage has shown to result in smaller bilateral hippocampal volumes. The hippocampus is a center in the brain responsible for memory and learning. So this obviously leads to lower performance on memory and learning tests. And then mental health, a lot of people take marijuana in attempts to actually treat anxiety or depression, but studies have shown that long-term usage actually leads to worsening of anxiety, depression, along with psychosis and suicidal ideation. This is likely due to neurotransmitter imbalance, as marijuana manipulates the neurotransmitter acetylcholine, also caused by dopamine system imbalance. Then other factors could be motivation, withdrawals, and addiction. Then we'll briefly look at cardiovascular disease, as cardiovascular disease is the #1 cause of death in the world, and we know smoking cigarettes plays a major cause in development. And now scientists are starting to look more at marijuana usage and how it may contribute to cardiovascular disease. So a couple cases here. This first one, 30-year-old presented to ER, no previous health issues. He had necrosis of his big toe or dying of tissues. Imaging found occlusion in his popliteal artery, and doctors attributed this to cannabis-induced arteritis, which is just hardening of the arteries. Then the second case, a 17-year-old presented at ER. Again, no previous health issues. He had chest pain radiating to his neck, and he was having a transient myocardial infarction or heart attack. This was attributed to marijuana-induced vasospasms, so sudden narrowing of blood vessels. And there was also a similar case seen in a 29-year-old. And then the third case, a 20-year-old presented to the ER. Again, no previous health issues or cardiovascular disease. He had an acute myocardial infarction, and imaging found an occlusion in his left coronary artery, and this was due to marijuana-induced platelet aggregation. So overall, marijuana can lead to platelet aggregation, arteritis, vasospasms. It's also going to increase heart rate, increase blood pressure, and it can lead to higher risk of myocardial infarctions or strokes. That's all my time. Again, for more information regarding these specific topics I talked about, I encourage you to visit these reference articles, as well as completing your own research before using marijuana. Thank you.